When an animal is presented for boarding, specific information should be obtained from and communicated to the client in order to provide the best care for the animal and ensure the client has a good experience. In this video, we will discuss the proper guidelines for admitting and discharging non-medical patients. Questions that a client should be asked prior to or when presented for boarding include: what is the animal and client's name, including spelling and pronunciation? Continually mispronouncing an owner's name can be irritating to them, and calling a pet by the wrong name will most likely not get their attention. Are all required vaccines current? Verifying vaccination history prior to boarding helps protect the client's pet as well as other boarders during their stay. Does the animal have any medical conditions? A dog with arthritis, for example, may require him to take the elevator instead of the stairs. Is the animal currently on any medications? If so, did the client bring the medication with them, and what are the dosing instructions? There are instances where a client is giving a different dose than the label instructions based on their veterinarian's advice, so always confirm the dose with the owner as well as the last time it was given. Does the animal eat a special diet? If the client brought their pet's food, get clear instructions on how often and how much they are fed, and make sure it's labeled. How long will the animal be staying? Are there other services the client would like, such as a bath or grooming before the end of their pet's stay? Lastly, what emergency contact information should be used if the animal becomes ill during their stay? This is often the owner's information, but can also be the owner's friends or family members. The emergency contact should be someone that can authorize or approve recommended treatments by the veterinarian.
When you're boarding a pet, you are responsible totally for this animal's safety and well-being. Boarding can be stressful, and when they're stressed, things change. So it's so important to try to minimize the stress by knowing this animal, what its little nuances are. So what does it eat? Does it have a special way it likes to eat? It has to be in a bowl, it has to be on a plate, it has to be warmed. Medications, that's extremely important to know what medication the pet is taking. If they just give you a bag of pills, stop them. Try to figure out what's inside that. When does it need to get it? Is the dose different than what it was getting before? Oftentimes we may be boarding a pet that's not one of our primary clients. So if they're seeing another veterinarian, get the name and number of who that veterinarian is so you can call, and oftentimes you need a copy of the medical records. It makes things so much more simple that way. And the other thing I think is always good to know is, are there any other little tricks of the trade or medical conditions that it has? If a pet has seizures, you may need to know how often is it, what do they expect you to do? Another item that's really important to get all the details is vaccines. Vaccines are essential to keep the pet that's coming in for boarding healthy and also all the other pets in your facility healthy. Each practice is a little bit different as to what they require for vaccines. So if this particular client isn't one of your regular ones, make sure when they call to make that appointment that you get a copy of the vaccine history from the other veterinarian. And if there's variances in what you require and they require, let them know ahead of time so they're not going to be surprised when that pet comes in.
A client should be made aware of any charges expected to occur during their pet's stay and what those charges entail. In addition to boarding, clients may wish their animal to have a bath or other services during their stay. Clients also want to get their money's worth, so it's important to communicate that boarding fees include things such as exercise for their pet, cleaning the cage regularly, feeding, medicating, and being cared for by a professional and trained staff. Proper documentation is crucial to communicating effectively. A boarding animal should always have identification on its door with any alerts that the staff should know, such as food aggression. Accurate record keeping ensures that any staff member can see what medications a boarding animal is taking and when the medication was last given. Proper documentation is also essential to monitor for any concerns, such as decreased appetite or lack of eliminations.
Documentation is essential. If it's not written down, it didn't happen. And sometimes disasters happen and a client will want to know what happened to my pet. If it's all written down, you can say when it happened, where it happened. The pet comes in and has its belongings. Write down what belongs to that particular pet because they want it to go home with their belongings. Is there a medical condition that we should know about? Write it down. And in between shifts, this is also very important. You may be seeing something and you want to make sure that the next technician that takes care of that pet is aware. Maybe it has a little bit of a cough. Maybe it's off feed a bit. A day or so, maybe it's not too much of concern. But if there's a trend going on, if you're recording that, didn't eat yesterday, didn't eat the day before, after a day or so, this can be very, very serious. So you need to document it.
Owners who have boarded their animals often want to know how their pet did during their stay. When discharging an animal, be prepared to answer questions that owners often ask, such as how was their appetite or if they seemed upset. Owners are often concerned that their animal will be too anxious or depressed when boarding, but the majority do very well. If a boarding animal is being sent home with any new medications, the owner should be informed of what the medication is, the dosing instructions, and when the next dose should be given. Animals should always be sent home clean and odor-free.
When a pet goes home from boarding or being in the hospital, keep in mind that pet owner realizes they've lost control over that pet when it's not in their possession. What happened? I don't know. It's kind of scary. Did it really have a good time? Did it eat? If you can document, oh yes, the weight was such when it came in and right now it's going home with that same weight. Must have been eating. Did you know your pet really likes to get scratched behind the ear? Oh, now they realize this wasn't just some animal that was in a cage. You've realized this is an important member of their family. You've bonded with that pet. If there's medications that it's going home with, something new, make sure they know how to give the medication. Antibiotic pill for an ear infection, no, it doesn't go in the ear, it has to be given orally. Explain how it was given in the hospital, what they need to go home with, when does that pet need to come back. Oftentimes it's important you call the owner the day after that pet's gone home. All these things are so important to do before you bring the pet to them, because once you bring the pet, all bets are off. All they want to do is play with their baby.
Every facility should have its own SOP or standard operating procedure for the collection of payment. However the payment is handled, there are some things to consider regarding the client's invoice. Was the client charged appropriately for each day the animal was boarding? Did they pick up a day early or stay longer than they originally planned? Were any additional services rendered or medications dispensed during their stay? It's important to be sure the invoice is accurate before checking out a client. It can be irritating to clients to pay their invoice and realize they were charged for an extra day, or to check out and then be told another payment needs to be taken because some charges were left off the invoice. Obtaining the necessary information and clear communication are essential to provide the best care for a boarding animal. This will also ensure quality service to your clients and keep them coming back.